Good morning, YouTubers. Good afternoon. Good evening. Whichever one you watch this video. Well, right now it is almost 8 a.m. in the morning. Gonna talk about that coronavirus and let's see if I can come up with some theories and see what happens. The theory about getting coronavirus in your eyes. I had looked that up on April 9th, and it was not, and on I used it on the Google search, and it didn't have no information, but it is. They said it is possible, and apparently, I'm trying to think, like a lot of tests on coronavirus has been coming out negative, but yet you already have antibodies. My theory is supposedly the coronavirus did get into your eyes, you know, and somehow your own immune system attacked the coronavirus before it got into your major systems, like your lungs, developing other stuff, and other problems to your system, because it affects a lot of coughing and all that other stuff. So I'm guessing it does get in your eyes, but somehow it depends on the person's immune system that it goes ahead and blocks it. And when you feel like, "Oh, I'm just gonna get tested for this, even though I have symptoms, apparently your immune system had already fought it off, and you're corona free, and you got the corona antibodies. So when they test you, like swab you, they're looking for it within inside your lungs and stuff like that, and it's coming out negative. When if you check the blood in your bloodstream and you're checking your antibodies, guess what? You have the antibodies for the coronavirus. So apparently, I'm thinking it is now getting in your eyes and bypassing your major systems, your lungs, because your immune system fights it off before it even hits your lungs. So I think this theory of mine, I think, is correct. If you want to wear glasses, I would say safety glasses. Try, like kind of like the ones you weed eat with or whatever. I think that's your option. They hadn't made it official, but to me, it's more safer. And to me, this theory of mine sounds more accurate. And I did, what do you call it? Try to get an answer out of it on April 9th. Now, as far as coronavirus mutating, um, mainly on children, I'm thinking there's more different symptoms going on there. It's affecting a lot of the younger. Um, I guess my age limit would be 18 and under, as far as them being, children wise. That it affects different systems. So not only that I heard that it came out negative for coronavirus, but it did have the antibodies. Like I said, immune system failed. The immune system failed on different areas, so it attacked another area other than your lungs, your regular symptoms. So now we're coming to a phase where symptoms, you're gonna have to have another chart for children as what symptoms are for those, because this is new, and this what should have, by China and Italy, they should have already had some type of warning to the United States or other countries, Russia and all that. There's got to be some type of form of communication as far as what their children are experiencing across the globe, and what ours are, what to expect, because the wave had, different waves hadn't hit. Expectancies as far as like the coronavirus impact on your body, as far as your age, they say it hits more on the younger and more on the older, and vice versa, kind of like in the middle. You're like kind of like a ping pong ball, yay or nay, depending on your health system, your immune system. So I guess you could say my next question is as far as outbreaks, hotspots. Yes, the low areas that hadn't seen any hotspots are now going to be the new hotspots. And I say just keep your distance, 6 feet or more. Mask. You now you can wear your clear glasses, whatever, sunglasses. You don't have to wear them in the store, but you know what I mean. So now we kind of gotten that theory. And another theory of mine is, since now that we're finding antibodies of coronavirus in people who hadn't even shown any symptoms, and now I think we know why is because it's going in through our eyes. And that's why we see a lot of doctors and nurses wear face shields. Because guess what? It could go into our eyes, but our immune system attacks it before it gets to our lungs, and we have all that, you know, the symptoms of a regular coronavirus. Uh, I keep saying because I'm trying to think of things. And I think this coming up winter was going to be the worst one ever. For some reason, coronavirus loves cold air. It loves cold. So I would say beware, like, you work at a meat plant, and it's nice and cold, keeping that meat cold. If you're working like like a plucker that pulls meat and vegetables out of a cooler, same thing with the freezer. You have those fans that like your, what do you call it? Your HVAC system kick on, and it circulates. I mean, to keep that temperature. Like, I guess your fruits and vegetables stay at like a 40 something degrees. Same thing probably with milk and eggs. Just maybe a little tad cooler. And of course, your meats, when they're getting slaughtered, are about maybe that temperature too. So that system's constantly circulating in an enclosed building, and of course affecting one individual after another, and especially working side by side, especially in that slaughterhouse. Then yes, you have a major outbreak, you have a major problem, corporation, and of course symptoms don't fall off between till 5 to 14 days till you start to see symptoms. So even if you get tested, you might be negative, but yet you might have the antibodies, meaning you probably had gotten sick. So guess what? Gotten it through your eyes. There you go. And I expect this winter, since it's gonna be cold, like I said, it's gonna be the worst outbreak ever for coronavirus, because a lot of these bacterias and flus and colds and all that viruses love that type of temperature. That's a breeding ground. That's a spread. It doesn't really kill them. You know what I mean? So they got room to play, people to see, and all that stuff. I would, and in my prediction of within the next 5 years, this is my prediction. Everybody in the entire world, I would say 95 to 99% is gonna have or had coronavirus and probably develop antibodies. And I know there's gonna be a lot more people that are gonna pass away. My condolences for families that have already. But my prediction is the winter months are gonna be the worst, and my theory is about 95 to 99% of the planet, of Earth, of the people. As far as animals, yes, animals could get it too, but my theory is that number is gonna stick with me, because there's still gonna be a lot of people on the Earth. It's just they're gonna already have gone through it, and they don't. Some of them not gonna show symptoms, like I said, and others are. So animals, as far as animals, thinking possibly that since they could get it too, and everything, I'm not too sure. I hadn't came up to see if any symptoms on them or whatever. I think I heard they had antibodies in, I think, a tiger or something like that. And I think they said it is passable, spreadable to their animal, to their, to the human. So it is like a, it can be I think it can be passed. So do not kiss your dog or do not kiss your cat. Anyway, your dog licks your hits. You know what? Anyway, let me not go there. So yeah, stick to this. I think these are my theories, and these are probably facts. I'm hoping maybe somebody could research this stuff and I mean not research it, but come up with solutions as far as a vaccine for this virus. There will be possibly a vaccine. It's already being tested on monkeys, I presume, and I think they direct injected them with this virus, so they don't like drink it or anything like that. So I think once you inject it into the blood system, like I said, kind of like your eyes, it gets into your system and your immune system fights off it. So that's, I don't know. This is a theory about mine about the getting in through your eyes. So hopefully we, take this in mind that this is a new thing. So just just trying to help everybody see if my theories are correct or not. And if people want to lash out and say you're a liar, blah blah blah, I mean, haters welcome too, I guess. But anyway, I'm gonna close it out. Y'all saying have a great day, stay safe, stay coronavirus free, and take care of your family. All right, peace out, YouTubers.